You're welcome to my channel. I'm Kosim.
I'm next edit today. I finished some months ago, and currently I'm doing my internship. Next quiz, then the anatomy and physiological part.
So, how hard is the professional exam? And
A student of University of Ibadan. I just finished currently.
so, and you said you just finished. Like, is it after you are finished now? What are you doing now?
Well, okay. I finished some months ago, and currently I'm doing my internship.
So, one of the questions that people asked a lot. In fact, people asked me that question a lot. Like, Kosim, how hard is nursing school? Despite the fact that I'm not a nursing student, or probably I've not been to nursing school before, but people think I should have that kind of information, probably because I've been dealing with students which they think that I should have experience. They should tell me their experience. So today I have uh, Rachel here. So she wants to share the experience of nursing school with us. So she will be answering the question of why, as in the reasons behind nursing school. Is it really hard? Then if it is hard, then why? As in there should be reasons behind everything. So let me ask you, is nursing school really hard?
Well, nursing school is hard.
Okay.
Nurses, we deal with patient life. So it actually takes a rigorous, immersive approach to care for patients. So we don't joke with it. So nursing school is hard.
So you were able to look my camera. So nursing school is hard, right? So, but I just know that it's not as if nursing school is just hard like that. So there should be reasons why nursing school is hard. So let me go by like let's talk about the workload. Like let's take it from there. So how is the workload in nursing school? Like the
Okay, thank you for your question. When as you're coming in from secondary school, a nursing student, you have a lot of things to do. You have a lot of things to read. Imagine you come from secondary school, you enter tertiary institution, maybe first semester, you have like 13 courses to do and all.
13 courses?
Yes. So you have a lot of things to do. And then you have a lot of presentation. You don't expect your lecturers to give you everything in class. So part of learning process is presentation. You have to do presentation, you have to make your slides yourself. And then the anatomy and physiological parts.
So are you talking about the first year of being a nursing student or the second year? Or you are talking about the year as in generally now?
Okay. When you are coming directly from secondary school,
okay,
you enter 100 level.
Yeah.
And so 100 level, you are not under
your department.
Yes, okay. Faculty of Clinical Science. That's what we call it. So you are under Faculty of Science. So you are going to do science courses and probably some other courses borrowed from other departments, so like sociology department, psychology department, because I could remember then.
So let me ask one question there. Does that mean in 100 level, like being an 100 level student, like okay, you cannot call yourself a full nursing student yet? Because there will still be some people that they will not even cross to that 200 level where you start the normal nursing stuff.
Yeah, I can say that while in 100 level, you can't call yourself a nursing student because before you can cross over to 200 level, because when you get to 200 level, that is when you are fully in the department. You won't be offering any departmental courses. Yes, when you are in 100 level. So there's some criteria to meet up with. I think you must pass your chemistry, you must pass your physics, and then this general
courses. So, but if we are saying that now, so can we say that the workload we are talking about now, being a nursing student, doesn't really start from 100 level? Like you can say everything begins in 200 level, right? Or probably 300 level, because I know very well that the clinical stuff starts 300 level. 200 level is where you only, because I'm a student of allied science too.
Okay.
So, and being a student of allied science, I know 200 level it's where we do this anatomy, physiology, theoretically, right?
Yeah.
So when you get to 300 level, that's when you start your clinical posting and the likes. So can we say the workload starts from 100 level or it starts from 200 level? Like now you said as a nursing student,
Okay.
you are under Faculty of Science in 100 level.
Yes.
So that one, it means as a nursing student now, you are going to experience the same thing with other students that are not nursing students in 100 level. So if I get you very well now, is that the workload starts from 200 level.
Well, that's not what I'm saying
Okay.
in essence. Because when you enter 200 level, you have a lot of things to do. I said something earlier on. I said, you imagine coming from secondary school, you enter 100 level and you had like 13 courses to do.
Okay.
That one is workload alone.
Okay.
So because I could remember then my first semester, I did so many courses. I think I did 13 courses. I was running up and down to borrow from other departments. Whereas some of my colleagues, they were just borrowing from maybe 2 or 3 departments.
Yeah.
I borrowed from different departments, other Faculty of Science.
I understand.
Then I went to
and everything that you have to do, like if you have to do chemistry now, it has to be in the chemistry department. If you have to do physics, it has to be physics department. If you have to do biology, it has to be biology department.
We don't really do, but we did zoology.
Zoology.
So under department of zoology.
Zoology.
The other courses I'm saying is there's some everything you just mentioned now, they are under Faculty of Science.
Yes.
So sorry, Faculty of Science. There's some people that they did not even leave Faculty of Science. Everything they did was under Faculty of Science. I'm talking of some other department like that. So as a nursing student, you have to go out of Faculty of Science, you go to Faculty of Social Sciences. We did psychology there. I could remember we were having lectures with some law students. They were like, nurses, what are you doing here? Yeah, nurse, so what are you doing here?
Yeah, I could remember that too. Like there was this course I offered to, like they call it sociology of medicine.
Okay.
So these sociology people will be like, why are you guys even here? Like all the way from Faculty of Allied Health Science to Faculty of I don't know, maybe social science or what they call it, I don't know.
Yeah.
So I really understand what you are saying. Now, but can we say that, okay, let me ask you one question again before you move into talking about the workload right from 300 level, as in the workload right from 200. Now, is it that in 100 level, you don't do anything that has to do with nursing at all? In 100 level? Okay, in 100 level, I can't say that we did not do anything related to nursing at all, because we did zoology, and you know zoology is actually related to nursing. I can say that most of what we did in 100 level, they are just like prerequisite to nursing, like preparing us for the course. Because most of the things that we did in 100 level, we actually find them useful. So in 200 level, 300 level, like that. So just to prepare us ahead. Okay, so it means the workload really starts from 100 level. Yes, so from 100 level. So, and anything again about the workload before we move to just like you said, in 200 level, 300 level, sincerely, like you have a lot of things. As in, you have a lot of things, deadlines. Do you know what makes me understand that nursing is hard? You know, combining all this kind of clinical work with theoretical aspect of things again. Like it's not as if when you are in 300 level that everything will just be posting. Like the posting will be the but you will still be attending lecture. Like they will still be teaching you in the class. Yes, in fact, I could remember there was a day that I went to the ward, and the following day was supposed to be for my biochemistry test. Like almighty biochemistry. I could not focus on the word. I was just reading. Nurses on the word were like, what exactly are you reading? Imagine that kind of thing. I know my attention should be on the word, but it was divided because I had to read for my test the following day. So it should not be like that. So, but with this workload of a thing now, so can we say that an average student is not meant to be in nursing school, like being an average student? Well, okay, I can't say that average student, but it depends on the way you can manage your time and yourself too. Yes. So it doesn't really mean how you are coming. Like it means how you really want to be committed to the present situation of things. Yes, because there's some people that before they were actually probably good, intelligent and all that. But all of a sudden, when they got to nursing, they'll be like, hey, there was nothing to write about them. So I really understand. But there's this thing I want you to point out now, like which is also a very vital, very important question that people ask me a lot, is that people believe that all these medical courses, especially talking about medicine and surgery, the dentistry and nursing itself, that it seems to be harder in school like University of Ibadan and some other school like that than other schools. Is that true?
Well,
Because I know definitely you will have mingled with other students from other schools, like, right? Is that true?
Sure, sure.
So what can you say about
Okay,
that?
other in what sense?
Like the workload we are talking about.
Well, okay, workload. The workload, I feel it is general.
It's general,
Because if
okay.
you are using university standard,
Okay.
and also we have something called NMCM, that's Nursing and Midwifery Council. So they actually have their own curriculum, which I think is general to all tertiary institutions.
Okay. Talking about the workload now, so we understand that the workload is much and it is still bearable.
Yes.
It's bearable. It's not as if it is not bearable. So in fact, if it is not bearable, you will not be a graduate today now. So it's because it's bearable. And just like what she has said, the point is, even if you are an average student, the workload is still bearable for you. So as far as you are ready to commit yourself and focus to the present situation, so not because you are coming. In fact, for you to get nursing in the universities in Nigeria, especially federal universities, as in for you to get nursing, I think you can do it. For you to have that jam score, pass the pursuit TME, you can do it, right?
Yes.
So don't just be calm. So it is hard but bearable, and it is what you can do. The second thing I want us to talk about now is the clinical aspect of things. So how do you think it's hard in that aspect?
Well, clinical aspect. You know, when you get to hospital is actually a new environment to most of us.
Oh, okay.
Probably I think we started going to hospital. I mean clinical posting when I was in 200 level. So it's
200 level?
Yes.
This nursing self 200 level. But even me, I used to think that because I did a video. That was a video I did like I think probably last week. I did that video on nursing program, and it was because what I had from some nursing students I interact with was that they started the full practical, like the full clinical posting in 300 level. So I made mention in that video that your clinical posting will start in 300 level. So are you telling us now that everything starts from 200 level, like the posting?
No, I said University of Ibadan.
University of Ibadan. You said that, okay. So that's one of the things. That's one of the reasons why you said that. Okay. No, Allah, you can continue now.
So actually, you are new to the
hospital.
You don't know anything. Okay, maybe you actually been to the hospital before to care for your relative, or you were being admitted. But then you can't just do it like nursing student or a staff nurse. So you are new to the environment. People, nursing students that actually go to the hospital, they are not familiar with sick people. You see some people being unconscious. You see all these tube, the gastric tube, something you are not familiar with. You
before.
See people that are very, very ill, and from that you can actually develop fear. Another thing is probably you've never seen a big wound before. You just saw somebody.
So they just bring that leg to you, like, see, you'll be like, hey, see me, I'll come tomorrow like this.
And imagine you seeing maggots coming out
from wound.
What will you imagine? So something like that. So
it means if you are coming to nursing department, you must prepare for something of such.
Yes.
So prepare for something of such. So you shouldn't let that be. It shouldn't be something strange for you, especially if you have watched this video, that you will be exposed to that kind of thing. Like you will see what you have not seen before. Even despite that you are still a student, you will see what you have not seen before in the clinic, and you have to bear with it. So
and I want to say something like the ways in which you can manage this. Number one thing, you can actually get information from your predecessor. Like, okay, what are the things that I'm supposed to know?
No.
Because number one, if you are going to the hospital with like you don't really have what to say.
Okay, this you are saying now is a kind of, you're trying to like kind of provide solution to that thing. You are saying that challenges that might come up in the clinical posting and practice aspect of things. Okay.
So Imagine you going to the hospital without having anything on your head,
Right.
okay, and you want to go and take care of patient.
Patients.
So don't just limit yourself that okay, I'm a nursing student, I don't have to do much work. But if you go with that mindset, how do you want to learn? So you should actually prepare yourself, get information, read whatever you are being taught.
Like see yourself as a nurse already.
Yes.
Like I'm a nurse already.
Yes.
Okay.
Yes. And another thing I want to talk about is please, whenever you are going to going for clinicals and going to the hospital, please and please eat well. There is no way you want to take care of people that are sick if you yourself don't take care of yourself.
If yourself as so, if yourself you are internally or let me say psychologically sick.
Yeah. So you have to take care of yourself. If you are sick, you can actually tell your colleague that you are working with that I'm sick or I want to take sick leave, I want to do. Make sure you inform somebody. You just have to eat because most of our procedures we do it while standing. Imagine you standing for like 3 hours or more.
In fact, that's one of the things that makes me like I used to be like, me, I can't be a nurse. I can't be a nurse. That they will now call me. I will now go to that place I used to go and see your patients. I will not stand up for like I will leave this ward, go to another ward, go to another room, go to another room again. Standing. So if you are coming to nursing department, you must be prepared for this, and that is one of the reasons we have been telling you now that nursing is hard, and it is what bearable. Now, can we say that we have talked well on the issue of clinical practice, and we move to something else? So, one of the questions I get always about the difficulties in nursing school is about the professional exam. So now, I want to ask you, like, how hard is the professional exam, and what do you have to say about that?
Okay, professional exam, just like the way you said it, it's a professional exam. So it is not an exam that is being set or constructed by the tertiary institution. So it's we have I said something about nursing and midwifery council. We have a curriculum. So it is council that actually sets the exam. And the exam is external exam, and it is general to
all institutions offering nursing.
Yes.
Okay.
So, and when you are preparing for a professional exam, you have to read wide. You cannot just only memorize. You have to read and understand rather. Imagine you dealing with a disease condition. You won't limit yourself to that disease condition because you have to know the anatomy and the physiological aspects of the area that is being affected.
You applied stuff. Okay.
So, and you know that anatomy, probably you've done anatomy in 200 level. So you still have to revise it. So you have a lot of things.
So it's not as if you think now that I am now in 500 level. So I have nothing to do with 200 level or 300 level. So going to write professional exam, you have to read all through, like what you have been taught in 200 level, what you have been taught in 300, what you have been taught in 400, and what you have been taught in 500. So it's what you use to prepare yourself to write the exam. So I will
okay, my advice for people
that want to write the professional exam, just like outside.
You know, if you don't plan yourself very well, you are entitled to fail. Yes.
Yeah, definitely.
So okay, because professional exam is coming probably in 2 weeks time, so you have to start preparing now. No, you've already missed it. Your professional exam, you should start preparing right from day one. Yes. How do you prepare right from day one? Anything you come across in nursing, don't memorize it. Try as much as possible
to digest it.
Understand because it will become part of you. You have it as the tips of your finger. So it's not like okay, when I have to finish my exam, then
I have to go and start reading probably like a month before the exam. Now, let's just because I don't want to make this video to be that long, so that's why I have to just let you stop that like that. Now, the professional exam of everything, is it that you write it when you are in school or you write it after you have graduated from the school?
Okay, professional exam, you write it while you are in school.
While you are in school?
Yes. If you
pass it,
if you're actually privileged to go to
university
or nursing,
not
school of
nursing,
you have to write it. But in school of nursing, they do write it at the end of their program. Because you know in school of nursing, they actually spend 3 years.
3 years.
So after the 3 years, they write their exam. That is general nursing exam, which is your RN. Although there are other specialty in nursing that you might want to write professional
Like
exams for.
midwifery
Yes,
and
midwifery, have public
public
health.
health,
So it depends on
or
what
what
you
you
want
want
to
to
write.
write. Okay.
So we write it.
So does that mean being in nursing, being if you study nursing in the university,
Okay.
like you can take all this professional exam?
Sure, you can actually take,
Because I know if it is that of school of nursing.
Okay.
So to take if you go for basic nursing, you can only take the professional exam for RN, that is the registered nurse or professional.
If you go to
school of nursing.
yes, you can only take RN.
Okay.
Although we have other school like school of midwifery. Maybe when you are done with your RN in school of nursing, you can
Nursing,
also go to school of
So midwifery.
Right.
So in a nutshell now, so what we are saying is the professional exam in school of nursing is hard and yet bearable. So you can really write it and pass. So if that is one of the things you have been hearing, that you will do this, you will do that, yes, you will do it. It is difficult, just like you said. So telling you now that it is difficult is a way for you to prepare ahead as a student, even if you are in university now studying nursing. So it is difficult and you really have to prepare, especially with what you have been taught from 100 or probably 200 level till you graduate. So now let's talk about something important too before we round it up. Now if we are saying nursing is difficult, is that now let's look about how is money needed in nursing school. Like, now there are some courses that if you get admitted, there's nothing to spend after your school fee, and you don't have anything to get. So nursing, does it really require much more? I'm not talking about your TPL. I'm not talking about your TPL.
Well, without money, there is no nothing.
Nursing, wow.
That's
even in federal university.
Of course. Forget about that we subsidize by the federal government. You still have to pay for some.
Okay.
Part of the textbooks, and whenever you hear nursing students, they expect you to have all these bulky big textbooks. Yes, you should only buy them with your money. All these professional exams that we do, right? You have to pay for it. We have all this posting that we do go for. We pay for it.
But I think that I used to see this when I'm living here living in Ibadan. So I used to see this bus. I used to carry you guys around this college of medicine. It's not free. No. Are you for real?
Sure. You pay for it. It's not free. So just add it at the back of your mind.
It's not free. Wow. Free. In fact, some of the time that I see you guys inside this thing that you do like this, I think see this people, they enjoy. So it's not free. So you have to use your money to finance those things. So if you are coming to nursing or you're going to attend nursing school, you should get it to your mind that you are going to spend. You are going to spend, and you should prepare for that. So can we just make this the end of the video? Okay, you know what? You will do something for me. Just try and tell people now to subscribe to this channel. Like,
okay. I will actually advise you to subscribe to this channel.
Yes, actually, because
you get more information
details that you want. Yes, in fact, a lot of videos coming up. In fact, with this very channel, we are going we have a long way to go. We have a long way to go, and most of the video I will be bringing up in this channel will be an interesting one that you guys will like. So don't forget to subscribe to this channel, share this very video, and like it. In fact, let me say again, make sure you share it with other people that you think they will need it. So see you in another interesting video like this. Bye for now.